Good morning. Get everybody's attention here. So good morning, everyone, and welcome to the Bloomberg School of Public Health for its fourth annual symposium on the prevention of child sexual abuse, a public health perspective. We are honored to be hosting this important event. We're thrilled to see so many people here today. My name is Joshua Else, and I'm the Associate Vice President for Development and Alumni Relations at Johns Hopkins University, where I oversee development efforts for most of the professional schools across the university system. It has been my distinct pleasure to ensure that the groundbreaking research, which has made the Bloomberg School an international leader in public health initiatives, is well supported and continues to be on the cutting edge of prevention and the defense of human life since beginning my work back in 2011 here at the school. Our work here is truly unparalleled, and this is further demonstrated through the research being done at the Moore Center for Prevention of Child Sexual Abuse, which was founded through the generous leadership gift of Dr. Stephen and Mrs. Julia Moore in 2012. It is no secret that behind all of this incredible research, there lies a great deal of generosity and financial support. Johns Hopkins has recently extended a Rising to the Challenge campaign and increased a goal from $4.5 billion to $5 billion. Sounds rather daunting when you talk about $5 billion. But that money that we are raising across the university really allows us to be at the forefront of research in what we do. Behind each major scientific and technological development throughout history, there has always been some type of major philanthropic support, such as what the Moore family has done to establish here at the Bloomberg School. The necessity of philanthropy, science, and research is quite clear. Yet a study conducted in the New York Times in 2014 showed that the flow of public money into research efforts has slowed significantly. And if you're in research, you know that firsthand. And many of the research now is looking to private philanthropy to make up that ground. While, of course, any and all research towards disease prevention, important scientific discovery, and technology advancements is important and necessary, we must not lose sight that is exemplified in the mission of the school here, which, if you don't know the mission of the school, dedicated to the improvement of health through discovery, dissemination, and the translation of knowledge and the education of a diverse global community of research scientists and public health professionals. We are committed not just to the fight against the diseases and problems of interest, to our philanthropists and to our those even in our research field, but towards the fight towards global equity and health for all. This is where Johns Hopkins truly, truly shines. And we are here because Dr. and Mrs. Moore courageously gave to the creation of this center, which is dedicated to the research and eradication of such a terrible affliction on our global community, the sexual abuse of those most vulnerable and helpless, our children. This extends not just to the immediate circle of our American children, but to the children of our philanthropists, our researchers, but to the entire international community, which has been so decimated by the sale of their children into sexual slavery and poverty. The issues plague us not at home and abroad, and are often swept under the carpet due to that discomfort of discussing the abuse of our children. We are tremendously grateful to the Moore family for their generosity and courage. And like I said, we are working hard to cultivate support to push the world forward in health and in safety. I would probably be remiss, though, if I didn't say a few words about Steve and Julia. Hopkins is truly, truly blessed to have Steve and Julia in our family. Over the past few years, I've had the pleasure of traveling many times on public health trips with Steve and Julia to Barcelona, just recently a few weeks ago, to Cuba, to Peru. And I have to say, you really get to know somebody when you go on these trips. Steve and Julia probably say too well, you get to know somebody. But it's true, you really do get to know somebody. And I can tell you, it has been one of the true blessings in my life to work with people like that. When I was walking in this morning, Ricky Fine, who's here today, and Ricky's worked with Steve and Julia many times, and I've never heard you say this morning, Ricky, but you talked about the most important thing you did as a development officer here at the School of Public Health, and that was securing and working with the Moores on this gift. So I'd just like to recognize Steve and Julia and thank you for what you've done. So just wanted to give a brief intro about the importance, recognize Steve and Julia and thank them, and the importance of philanthropy across Hopkins and here at the School of Public Health. But now it's my distinct pleasure to really get on with the program and get beyond the philanthropy and what we do here and introduce our next speaker, Dr. Dani Fallon, one of our most distinguished professors at the Bloomberg School. She is an internationally recognized expert in aging disorders, and she currently chairs the Department of Mental Health at the Bloomberg School. Dr. Fallon's research focuses on genetic underpinnings of these disorders and on the integration of genetic susceptibility and environmental risk. She has been on the faculty at the Bloomberg School since 2000, when she was hired as an assistant professor of epidemiology. Just 3 years later, she was named co-director of the school's genetic epidemiology laboratory, a position which she held for 5 years. She has served as the co-director of the Genetics Core for Older American Independence Center at Johns Hopkins. Dr. Fallon also directs the Wendy Clegg Center, which is true, and we have Lucy Mione here, who also has been part of the Wendy Clegg Center. Dr. Fallon's research and work for the Bloomberg School is undoubtedly exemplary. She now is devoted to the Department of Mental Health and chairs that department. It is the first and only department devoted to mental health in a school of public health in the world. So please join me in welcoming Dr. Dani Fallon.
You don't look like Dani. I have your name up here. There we go. Good morning, everyone. As Josh said, I have the privilege of being the chair of the Department of Mental Health here in the Bloomberg School, which is also the department that houses the Moore Center for the Prevention of Child Sexual Abuse. And so it's wonderful to be a chair of a department that gets to showcase such dedication and talent as a center like this one. And as Josh said, I had a history, have a history of doing research in aging. I also have been working across neuropsychiatric diseases, including autism and schizophrenia. And probably now I mostly work in autism. And I see a lot of parallels to the kind of work that I do in autism and that our Wendy Clegg Center for Autism and Disability does in the school to the work of the Moore Center for one critical reason. And that is, while in autism as well as in thinking about child sexual abuse, there's extreme need for those affected to be treated and to think about better treatments, better approaches to intervention and services. That cannot go away. But an even bigger need is to understand the underlying or root causes and what we can do to prevent those. If we could stop the root causes, we would have less and less need for treatments and interventions. And so I feel very strongly about the idea of prevention in autism, just like I feel quite strongly about the idea of prevention in child sexual abuse. And in both worlds, we face the challenge of really convincing folks that prevention is possible, and that not only is it possible, but it is doable. And you will hear this is now the fourth annual symposia for the Moore Center, and each year I hear very convincing evidence that the tides are shifting, that we are thinking about not only the possibility, but the doability, if you will, of prevention of child sexual abuse, just like I hope we're moving that way in autism. So it is my pleasure to introduce Dr. Elizabeth Letourneau, but I want to start by saying that if you have not met the full team of the Moore Center, please reach out. You'll see there are gorgeous pictures in the annual review packet that some of you have. This is a truly incredible team. Not only are they extremely passionate and dedicated to work that they're doing, they are also some of the most competent people you will ever meet. I get compliments daily, in fact, 2 minutes ago from folks here at the school about how well run these symposia are, and that trickles to how well run the research and the practice mission of the center is run as well. And I think a lot of that is due not only to the individuals, but to their leader, who is Elizabeth Letourneau. So Elizabeth is a trained clinical psychologist. She has been working in the field of child sexual abuse for over 20 years, and early on recognized the importance of prevention and the possibility of prevention, and has now really dedicated her career to this sort of shared spirit of concept between she and I. I could say all kinds of great things about awards that she's gotten and things that she has done. I think one of the most important ones recently is her leadership to not only the center, but to her field more largely. She is just stepping down as past president for the Association of Treatment for Child Sexual Abusers, or for sexual abusers writ large, which I think shows her dedication not only to the research that she does and the work that she does here, but how she thinks that we should make an impact more broadly, and that speaks to how Josh was making our awareness that this is not only a local problem, but a global problem. So thank you all for coming today, and then I will also let us move on and introduce Dr. Elizabeth Letourneau.